Hi, my name is Sage, and my presentation is on trauma and grief. Grief caused by trauma is the most common form of grief that comes to mind when people think of others grieving. First of all, because of the dramatic nature of trauma, and second, because we can all empathize with those who have experienced traumatic loss. When I mean trauma, I'm referring to traumatic events which cause an individual to experience loss one way or another. Some examples include suicide, homicide, illness or injury, assault or sexual assault, disasters, accidents, war, economic loss, or near-death experiences. Since these occurrences are sudden and sometimes violent, the experience of grief is compounded because the bereaved was not expecting the loss and had no time to prepare or say their final goodbyes. For example, look at the disaster at Lac-Mégantic, Quebec. One minute they were enjoying a quiet Saturday night downtown, and suddenly they found themselves being chased down their main street by a river of burning oil. For those who actually witnessed the traumatic loss, they can experience grief mixed with post-traumatic stress disorder, or PTSD. PTSD can result in, according to the DSM-4, bad dreams about the incident, intrusive flashback memories, extreme negative responses to triggers, persistent avoidance, emotional numbing, sleep problems, irritability, angry outbursts, all lasting over 1 month, and all significantly affecting a person's ability to function in society. PTSD is not at all what you need if you're trying to cope with a traumatic loss. It is also theorized to be the cause of something called prolonged grief disorder, or PGD. It used to be known as complicated grief disorder. The symptoms of this include something called separation distress, which includes intrusive memories, thoughts, and strong yearning for the person or people who died, as well as cognitive, emotional, or behavioral symptoms such as avoidance issues, trust issues, bitterness, trouble accepting the loss, anxiety, poor appetite, or emotional unavailability. Persisting mental health complications after traumatic loss usually affects 10 to 20% of all grieving people. There can be certain variables affecting grief. For instance, take into account the nature of the relationship with the deceased, the stage in life of both the bereaved and the deceased, the presence or absence of social support, the culture within which the bereavement occurs, and the religious or secular background of the bereaved. Although grief is a very complicated issue and everybody grieves differently, professionals have tried to measure grief using these following scales. First one, the Texas Revised Inventory of Grief, which measures current grief and past disruption. Then you have the Grief Experience Inventory, or GEI, which looks at the longitudinal process of grief. And then finally you have the Core Bereavement Item, CBI, which measures the intensities of bereaved reactions as compared to others in a sampling of bereaved subjects. When professionals such as counselors or therapists try to treat people who've experienced prolonged grief, they use the following options. First one is gentle conversation. That includes avoiding cliches such as "you'll get over it" or "it'll get better with time," because when you really think about it, those are kind of demeaning. And also using active listening and then asking open-ended questions. Open-ended questions are questions that can't just be answered with yes, no, maybe, maybe not. They actually had to explain their answer. The next option is providing available space, which means being flexible with a client, and remember that grief is subjective and doesn't always follow a predictable pattern. Finally, you have engaging trust. Basically, that just means being trustworthy. The client has a trustworthy relationship with you. That allows them to have a better ability to build new relationships. For those trying to cope with loss on their own, they offer the following advice. First one is goal-focused, solution-oriented approaches. This is so you don't keep going over the same things over and over again, and you don't keep ruminating over the loss. The second is tolerance for other people's grieving patterns. Since it's very subjective when we're all different, we all grieve differently and have different lengths of recovery. Finally, we have commitment and affection for each other. This is in group cases, such as a family who's experienced a traumatic loss. Sticking together and establishing group cohesion is very important. Also, it is important to avoid blaming because that can increase the trauma for some of the others. And finally, not resorting to chemical substances such as drugs or alcohol as a means of coping. Even though my presentation has been about grief associated with trauma, I'd like to make it clear that grief can be associated with any sort of loss. It doesn't exactly have to be a traumatic loss. When you think about it, losing your job, losing your driver's license, losing your girlfriend is considered a loss. And by that I mean it's subjective. Some people may view losing a pet to be a severe loss, other people might not. And this is a construct of time as well. For instance, when the term PTSD came out, people often associated it with Vietnam veterans. But we all know today that PTSD can be associated with anybody who's experienced any sort of trauma. For instance, take a look at a disaster like Hurricane Katrina. Not only did a whole lot of people die, A lot of people lost everything. They lost their homes, they lost their jobs, they lost their livelihoods, and they lost their pets. The one thing I want people to take away from this presentation is that grief is a very subjective thing. People grieve differently and they view losses differently as well. The one thing we can do to support them is be very flexible. Keep in mind the nature of other people's losses and just how severe it might be on them. And be patient, because how we grieve is definitely going to be different from how other people grieve.